Hello, it's Dr. Sheila, and I am here in this video to talk about testing for the triggers of inflammation, so food and environmental allergy testing. And we are going to go through some cases, and I'm also going to explain to you the different ways that we can do environmental testing and food testing, and kind of the accuracy and some of the misconceptions I think that are out there. So the first thing I'm going to go over, this is the case of the young baby who I told you about. I had first started seeing out of residency who had recurrent ear infections and eczema, and mom was breastfeeding and she went off of dairy. Eczema improved significantly but not fully, and then when she went off of eggs and dairy, the ear infections and the eczema both resolved. So now, fast forward many years, I started to understand the mechanism and the pathophysiology behind what was happening. So here's what the studies show. This is a study of recurrent ear infections in food. So they took 104 patients who were 1.5 to 9 years of age, and 78% of them were food allergic. So they did food allergy testing on all of them. The main foods that they were allergic to were cow's milk, wheat, egg white, peanut, and soy. Then 81% of these patients were allergic to 2 or more foods. And that's why we always talk about this list of foods, that 11 foods that I told you that cause 90% of our issues. Sometimes it's not always just milk that we have to eliminate, and sometimes we have to take other things out. In the same study, they found that once they took those foods that the patients were allergic to out of their diet, their ear infection cleared up. So SOM stands for serous otitis media, and that is the medical term for fluid that persists in the ear. One of the reasons I love this study is because it was very well designed, and the thing that they did after the ear infections cleared up over a 16-week period of time, with the food being out of the diet, put the food back in the kids' diet, and 94% of the time the fluid came back, or the ear infections returned. So that is a good indicator that you take the food away, the ear infections improve, you put the food back, they return. So the foods that they found, I wanted to give you the breakdown of the food. So it was 38% were cow's milk, 33% it was wheat, 25% of the time it was egg white, 20% peanut, 17% soy, 15% corn, 10% orange, tomato, 5% chicken was low, and apple was low. And if you'll notice, this study was done in 1994, so this is not a new study, and I don't know why this is nothing we learn in training, but this study has been very important for me in my ability to help a lot of these kids start to improve their recurrent ear infections and to help parents understand what's going on. So a quick review, you've seen this before. This is the anatomy of the ear. This is our beautiful eardrum. This is the ear canal. And then this is the middle ear. And this is where the fluid starts to build up if you get an ear infection. This is that eustachian tube. Look how thin that can be. And that is collapsible. So if we have any inflammation, that is going to clog up, and that fluid is going to start to build up there. And that's where it's more likely to get an infection if that fluid can't drain out properly to the back of the nose and throat. So I'm reviewing this anatomy one more time because before we move on to talk about the rest of the foods, I just want to show you what it looks like through the otoscope. So the one on the left is a healthy eardrum. The one on the right is a big inflamed, infected eardrum. So I always let parents look through the otoscope because I think it's really interesting, and the kids love to do it too. But back to the anatomy. So if you have a child with recurrent ear infections, not only are we going to do this whole 7-step process and really look at their diet, but I also want you to pay attention. If they had torticollis or plagiocephaly, if they had to wear a helmet as a child, as a baby, I want you to make sure that you have either done some good craniosacral therapy, physical therapy, occupational therapy, or a good pediatric trained chiropractor to make sure that has fully resolved. Even if they're 3, if they had that when they were young, so torticollis is where they have a tight neck muscle. You see how the baby on the left, his neck is pulled over? That is torticollis. And that really needs to be addressed. And I just have found that can help. When we use that in conjunction with these other therapies, it can help prevent the recurrence of these chronic ear infections. This is just another picture of a baby with a flat head who had worn a cranial band to help with that flat head. And you could see the picture that's straight on. You see how his head is tilted to the left? So I want you to look at your kid's face and see if they look symmetric, see if they're holding their neck up straight, and make sure that they're rotating their neck back and forth equally. Okay, that was just a little aside. So back to the foods. I'm going to go through each of the foods now, and we're going to go through those 11 foods that cause 90% of our issues, and I'm just going to talk briefly about each one of them. So dairy is just the culprit so often. And what happens is that dairy itself isn't innately such a terrible food. It's what we've done to it. So if you were drinking milk, theoretically, warm milk out of the cow, maybe your neighbor's cow, and you're just having a little bit each day, you're getting a liquid that has probiotics in it. It's got some fat in it that we need for brain development for kids, and it does have some good health properties. What we've done to it is we're saying, okay, we're going to take this fluid and we're going to heat it up. That's what we do when we pasteurize it. That kills all the good healthy bacteria in it. It also can changes the configuration of the protein. Casein is the inflammatory protein in milk, and when we heat it up, it makes it even more inflammatory. Whey is the other protein that's in milk. So after we pasteurize it, then we homogenize it. And when you homogenize it, we take the fat globules and we press it down into the milk. And that makes it even more inflammatory. So the other thing that I talk about is the difference between those proteins versus lactose. So lactose is a sugar, and so lactose-free milk is not okay to drink while we're doing a dairy-free diet because it still has the casein in it. Really, the casein is the protein that we're going to talk mostly about causing the inflammation, whether it's recurrent ear infections or constipation or things like that. The lactose is the component of milk that can cause bloating, gassiness, and most people, after the age of 3, we start to lose that lactase enzyme. Most people have some degree of lactose intolerance, so we really want to be mindful of that. And into adulthood, most people shouldn't be drinking as much milk as they did when they were little, but I'm going to convince you that they shouldn't drink a whole lot when they were little either. So the second food is soy, and soy I think actually gets a bad rap. Whole soy, fermented soy can be a part of a very healthy diet. What happens though is if you are sensitive to dairy, about 20 to 40% of the time, you may also be sensitive to soy. So that's why we don't swap out cow's milk for soy milk. I did do that when I first started doing all of this. And what I saw is that sometimes the kids would come back about 6 weeks later when they were on, say, 2 or 3 cups of soy milk a day, and they would have fulminant diarrhea. It takes about 6 weeks to become sensitized to a food. So we want to be very cognizant we don't want to swap out a lot of our dairy products for soy products. So we're just going to limit it. You don't have to completely take it out, but we're just going to be mindful of it. And we're not going to do soy dogs and soy cheese and soy yogurt. If we do soy, we want to do things like edamame, make sure that it's organic. The fermented soys like miso or tempeh. Okay, then we have wheat and gluten, and most people have read about gluten and its inflammatory properties. A lot of the grains are pro-inflammatory. Most grains are pro-inflammatory, and gluten in particular, it's a big bulky molecule, and it can trigger inflammation, whether you have a sensitivity to it or not. So we're going to be very mindful of the wheat gluten. corn is really a food that does not get digested. Our body does not have the capability to break it down. And you can tell because if you eat a piece of corn on the cob, you can figure out the transit time of your GI system by just timing when you see the corn come out. So we don't want to be eating too much corn. And what I have seen is a lot of the families that we see who end up going off of gluten and dairy is they end up using corn for the crunch because it's the corn tortilla chips that are really yummy. But we just want to be careful not to be going overboard on corn. And corn is, if you don't get it organic, it's going to be genetically modified. And we're not going to talk too much about that right now, but that's part of the reason I really recommend doing organic, because if you're doing soy, corn, wheat, oftentimes those are going to be genetically modified unless they are organic. Okay, eggs, I really love eggs, and they can be a great healthy part of a diet, but if you have a sensitivity to it, like our little patient did with his eczema and recurrent ear infections, they may need to be taken out for a period of time. So we'll just be mindful of eggs. And peanuts. So peanuts are a legume, and the legumes can be inflammatory whether you have a sensitivity or an allergy to them or not. So be mindful when you're eating peanuts of how the kiddos react, how their stool is, and how they're tolerating them. The other legumes are, because I think this can get confusing, are peas, green beans, and then all the other beans, red beans, black beans, all that sort of thing. Again, many people tolerate them fine. We just want to figure out if your child is somebody who doesn't tolerate them, we'll be careful with them and not do too many of them. And then tree nuts. We know that the allergies to tree nuts, peanuts are just skyrocketing across the globe, and especially in the US. So we are going to be careful, and our whole goal is to clean up the gut and to have the gut with good healthy bacteria to decrease systemic inflammation, so that if your child does have an allergy, a true allergy where they could have the anaphylaxis, which is where your throat swells up, you can have trouble breathing, you can vomit, you can cough, you can wheeze, that if we can decrease their systemic inflammation and just get their system as strong and in balance as possible, in the event that they got an accidental exposure, the goal is that they wouldn't get inflamed as quickly, and there would be time to get the treatment that they needed and to get their EpiPen, their antihistamine. But tree nuts, as long as you don't have a true allergy to them, we just watch out for sensitivities. Almonds can be another one. I have found that a lot of times when we're going on these elimination diets, if we've added in too much almond milk, that can sometimes eventually be an issue, but it's not, we just want to monitor. And that's part of why I don't like doing a whole lot of any one of those milks. If you want to use them, and especially as you're transitioning, that's great, but we don't want to be doing 3 cups of almond milk a day. One thing I recommend is that you just swap out each week, buy a different milk. Maybe one week almond milk, the next week coconut milk, maybe rice milk. And that way there are things in all of those milks, so we'll spread out. There are things that allow it to sit on the shelf. So eventually, if we could just do water, that would be fabulous. And then fish. So fish is a really great source of omega-3 fats. However, we have that flip side that a lot of the fish it's swimming in the oceans. It can be contaminated with PCBs and mercury. So we just want to be careful and not eat it too often, not more than 3 times a week. And you really want to get the fresh caught sockeye salmon. The sockeye salmon is the lowest on the food chain, so they're going to be less contaminated. But if you're having an issue, if your child has issues or stomach upset after eating fish, we want to pay attention to it because it is one of the higher allergenic foods. Technically, fish oil does not have any of the fish protein in it. So when we're going to talk about our fish oil supplements, theoretically, people who have an allergy to fish can take a good pharmaceutical grade fish oil. However, I do not recommend it. If you or your child has an issue, a true allergy to fish, I don't recommend that you take fish oil. We can get the omega-3s in a different way. And then shellfish, that's just another one of the high allergenic foods, whether it's shrimp or clams or crab meat. So we'll pay attention to that. And then citrus. So citrus is lower on the totem pole, but definitely we can have sensitivities. And this is where I find, in particular, if kids have a perioral dermatitis where they have a rash around their mouth, we always look at citrus. I have a case of my old partner from my old practice where he had a little boy who had eczema pretty badly and asthma. And they took dairy out of his diet and maybe one or two other foods, and the eczema cleared up beautifully. But he kept getting this rash around his mouth. And with what happened is the mom, he was still using Pulmicort because he needed it for his asthma. And she read the ingredient list, and sure enough, there was citric acid in it. And he was getting exposed to that when he was getting his inhaler treatment. And so they switched him from the Pulmicort to Qvar, which is a little pump inhaler, and he did it with a little mask, and the dermatitis went away around his mouth. So I have seen lots and lots of cases where the issues around the mouth will improve when we go off of citrus. And then the last is sesame, and this is lower also in the big scheme of things, but the sesame seeds on this hamburger were the only picture that I could find. So we want to be mindful of foods with sesame in them in terms of the allergies. So to look at this single snapshot picture of the foods and then the environmental allergies, again, these are the list of the foods. And now we're going to talk about testing. So with food allergies and sensitivity testing, I think there's a lot of misunderstanding out there on the part of practitioners as well as families, as well as parents, because what happens is I often see this is parents will be told the child will have been skin prick tested, and they'll be told that the child doesn't have an allergy to dairy or eggs or whatever the food is, and so they keep eating it, not understanding that it could be a sensitivity and it's not an allergy that was tested for. So the conventional allergy testing, it's an IgE protein, whether it's a skin prick test or blood work. There is something else called a food sensitivity panel, and that's an IgG protein. That's one that is only ordered typically by integrative doctors or functional medicine doctors, and most conventional allergists will say, oh, that test is hogwash and you shouldn't get it. It's not accurate. And those are the tests, ALCAT testing. ALCAT testing is actually a little bit different technology, but those are some of the companies that make the food sensitivity testing.